Good morning, class. Last class we talked about the negative effects that a near-death situation can have on a child's development, and today we're going to be talking about how another severe trauma can affect development, and that's sexual abuse. Sexual abuse and child sexual abuse are unfortunately not an uncommon occurrence, which is why it's so important we study how it affects the person in adulthood so that we may effectively recognize and treat those negative effects. I simply want you guys to be able to empathize with and understand abuse victims before you move into therapizing them. So I'm just going to go ahead and start the lecture by defining what child sexual abuse is, since I came across this old definition that I do not want you guys to absorb. The 2005 definition defines child sexual abuse as a sexual activity ranging from fondling to sexual intercourse with a minor perpetrated by a person significantly older than the child. This is from the 2005 Hetzel and McCain study. And now the issue here is the phrase significantly older. Newer definitions do not include this phrase because there actually does not have to be a very wide age gap for it to be considered sexual abuse. The perpetrator simply has to have more power in the relationship than the child does. A more modern definition from the World Health Organization defines child sexual abuse as the involvement of a child in a sexual activity that he or she does not fully comprehend, is unable to give informed consent to, or for which the child is not developmentally prepared and cannot give consent, or that violate the laws or social taboos of society. And it goes on to say, child sexual abuse is evidenced by this activity between a child and adult or another child who by development or age is in a relationship of responsibility, trust, or power, the activity being intended to gratify or satisfy the needs of the other person. This may include, but is not limited to, the inducement or coercion of a child to engage in any unlawful sexual activity, the exploitative use of a child in prostitution or other unlawful sexual practices, the exploitative use of children in pornographic performances and materials. So this means that if an 8-year-old boy engages in any non-consensual act with a 6-year-old girl, it is still considered child sexual abuse. The reason I want you guys to understand this importance is so that if you one day decide to be a therapist, you can be more empathetic to a patient who believes they experienced sexual abuse, even if they say it was someone close in age. I have colleagues who have written this kind of thing off before as children innocently exploring each other's bodies, but if you say this to someone who experienced non-consensual sexual trauma, it's going to be very detrimental for their mental health. It will not make them feel better if you attempt to normalize the situation and assert that they were not a victim. The JKP blog has this wonderful article about the do's and don'ts of counseling someone who has experienced sexual assault, should you want to pursue that career path. Some of these don'ts include: don't expect one treatment approach to work for every individual, don't impose your beliefs or judgment on a client-patient service use, and don't blame, accuse, or give your opinions about choices made. Now, this trauma affects both males and females. However, it is statistically more likely for a female to experience sexual abuse before the age of 18. It's 1 in 9 for girls and 1 in 53 for boys. For right now, we're going to dive into a multi-generational longitudinal study that focuses on the impact of sexual abuse on female development. And before Penelope K. Trickett, Jenny G. Knowles, and Frank W. Putnam's 2013 study was published, the research designs for sexual abuse study were largely focused on acute reactions of children. Neither design facilitated understanding of how the experience of child sexual abuse affected development over time. One important finding of this study is that abused females met criteria for significantly more diagnostic and statistical manual of mental disorders, DSM, diagnosis than comparison or non-abused females. They exhibited greater comorbidity, which means having 2 or more diagnoses, with 53% of the abused females meeting DSM criteria for comorbidity, compared with 35% of the comparison females. Therefore, we can conclude that it is far more likely for mental disorders to manifest in women who have been sexually abused. The study also found that abused females scored higher on depression, trait anxiety, disassociation, PTSD, and somatic symptoms, as well as behavioral problems such as aggression, delinquent behaviors, and school problems. And by adulthood, the major group differences were higher depression and alcohol and drug abuse. Another ailment sexually abused females were more likely to manifest is disassociation. Now, disassociation is defined as a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. Disassociation was measured at multiple time points using a series of related measures spanning childhood, adolescence, and adulthood. The sexual abuse group was significantly more dissociated during childhood and adolescence than the comparison or non-abused females. Disassociation was found to be significantly associated with experiences of sexual abuse that were characterized by earlier onsets and multiple perpetrators. So if it happened earlier in their life and if it happened multiple times, the probability of disassociation is definitely higher. Disassociation was significantly associated with both physical and sexual re-victimization, domestic violence, and self-harm, especially self-mutilation. And one of the secondary aims of the study was to systematically examine verbal and nonverbal behaviors in sexually abused females that might contribute to their problems and symptoms, as well as serve as targets for intervention. In order to do this, a number of behavioral scenarios were carried out to examine the child's responses to structured situations and interpersonal interaction. One of these was the stranger task, which examined how participants responded to an informal interaction with an unfamiliar male interviewer who was blind to the abuse status during an 8-minute warm-up procedure prior to the start of psychological testing. The child was seated at the testing table and told she could draw a picture, color in a book, or read a magazine until the interviewer was ready to start. The male interviewer was seated at a desk across the room and busied himself writing and shuffling papers while engaging in light conversation topics such as school, weather, or sports. After the warm-up, the child was administered a number of standard tests. Coders reviewed a videotape of the child's behavior during the warm-up period for 54 discrete nonverbal behaviors, such as lean toward each other, legs spread apart, crotch touch, side head tilt, and mouth open. These behaviors were extracted from anthropological literature as common affiliative and social distancing behaviors, and a factor analysis produced a 3-factor solution to describe these behaviors, and they came up with wary, affiliative, and coy. And the abused females were significantly higher in the coy factor, which included simultaneous but contradictory approach and avoidance signals such as full smiling while shrugging their shoulders or showing their tongues while crossing their legs. So you can kind of tell if a child has experienced sexual abuse if they're making confusing signals, almost sexual signals, but then also hunkering down and getting scared.